Stroke is the leading cause of serious long-term disability in the United States, and it's also preventable. In fact, according to the National Stroke Association, up to 80% of all strokes are preventable. Stroke is the fifth leading cause of death in the United States, and on average each year, around 795,000 people suffer from a stroke. May is Stroke Awareness Month, and joining us now is Dr. Andrew Grande, a neurosurgeon with the University of Minnesota. Again, thank you so much for being here with us on this holiday weekend.
Oh, thank you very much. My pleasure.
With so many people suffering from a stroke each year, of course, we want to see those signs and symptoms, and there's even an acronym people can look out for if someone might be suffering from a stroke.
Correct, yes. There's the acronym FAST. F for facial drooping, A is for arm weakness, and then S for speech difficulties. And then S or T is for time, and it's really important for patients to get to the hospital as quickly as possible.
So you have to act quickly when you're seeing someone have those signs. What if you're alone and you think you're the person that's suffering from one? What should that person do?
Yeah, definitely call 911 right away. I think the temptation for people is to just roll back over, go back to sleep, try to sleep off the symptoms. But the reality is that this could be a stroke, and they have to get to the hospital as quickly as possible.
And once you get to the hospital, there is a current treatment right now for stroke?
Yeah, I think that's what's really important for people to understand. I think a lot of people are not aware that there are actual treatments that we can do. If you get to the hospital within 3 hours, we'll administer a drug that will break up the clot. And then within 6 hours, we can actually take a mechanical device and go up into the artery itself and actually retrieve the clot itself. Actually take that device up, pull it out. I've seen patients start talking right away as soon as we've pulled out that clot.
Goes back to that time reference where you have to act quickly, though, and make sure you get to the hospital.
And I think that's what's so critical, is that patients have to get to the hospital within that 3 to 6 hour period of time for us to do anything. And the reality is, unfortunately, if you don't make that time window, there's not a lot that we have to offer for our patients. And so it's absolutely critical that patients, if they think they're having a stroke, even if they're not, but if they think they're having a stroke, to get to the hospital as quickly as possible.
So that's the current treatment, but is there anything new that we can see in the future that could maybe make someone's recovery even faster or better, if you will?
Yeah, so I think what we're starting to look for are treatments for these patients that have had a stroke, that have deficits. And I'll see patients a lot of times who are looking for that treatment of what can I do now? And not only are we doing rehabilitative, innovative things like transcranial magnetic stimulation, but we're starting to also do some innovative treatments for using robotics in the arm for actually moving the arm for actually rehabilitating people. And this would then enhance the neuroplasticity in the brain following a stroke.
So sort of reestablishing that mobility, sending back up to the brain, this is how you move, this is how the arm works.
Correct, yeah. So current treatments for rehabilitation, you're going to actually have a patient try to move their arm. And if they can't, you may be moving their arm for them. We now have robots that can actually do that. One of my colleagues at the University of Minnesota, Ben He, has been working on actually non-invasive brain-computer interface. It's actually connecting the brain to a computer non-invasively, and then actually thinking about moving your arm. So we actually immerse the arm in this three-dimensional environment, and we have two arms. One reaches out for a cup of coffee, and you actually have to think about doing this. And so this encourages the patient to start thinking about moving that arm. They may not be moving the arm itself, but just by thinking about it, you're establishing or trying to reestablish some of these neural connections.
Yeah, training your brain to get that movement back. Absolutely.
Correct. And then we've paired that actually with this thing called transcranial magnetic stimulation, which inhibits the bad side of the brain. And that enables it inhibits the good side of the brain, and it enables that bad side to then really try to participate in that rehabilitative session. And again, we'll pair that up with the non-invasive brain-computer interface.
Well, great to hear these innovations, but unfortunately, sometimes people might suffer from a stroke, might not be able to get treatment. So what can be done for some people who have been able to seek treatment but still had a stroke?
So for those patients are unable to get any treatment at all, right now, I think it's really important for them to get into a rehabilitative program. And that's where my experience with patients, they want to get closest to home. And that may not be the best place for them. And so I'd really encourage patients to actually go to the best facilities possible. There are several here in the Twin Cities that really specialize in neurorehabilitation. And for those patients, I think getting them into those neurorehabilitative programs is really important. I can't also emphasize the importance of family and support for these patients. The reality of having a stroke is this is going to completely change your life. As far as getting back to work, or if you can't get back to work, how to deal with that, the social situation at home, etc. And really having that family support is critical. I've seen patients who have great family support and they're living very meaningful lives. And I've seen the converse where patients don't have good family support and are really by themselves and really are struggling. And so for these patients who don't have families, I guess that's where our community really needs to step in and really try to help out these patients.
Well, important information to remember this month and, of course, all year.
Absolutely.
All right, thank you, Dr. Grande, for joining us tonight. And, of course, for more information on Dr. Grande's research, we have a link on WCCO.com.